Welcome to Season 3 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Public Health on Call's first episode was released on March 3rd, 2020, when there were 1,922 documented cases of COVID-19 around the world, with just 21 known cases in the United States. 1 year later, more than 28 million people have tested positive in the U.S. The pandemic has killed nearly 500,000 Americans and more than 2.4 million people around the world. In over 260 episodes, we've brought evidence and experts to help unpack the day's COVID-19 and other public health news. This podcast has been downloaded over 4 million times in the last year, thanks to listeners like you. In recognition of the 1-year anniversary of the podcast, Public Health on Call is going live. In addition to our regular episodes, you can join us for a live episode at 11 a.m. every morning, starting Monday, March 1st through Friday, March 5th on the Johns Hopkins Bloomberg School of Public Health's Facebook page. We'll be talking to national leaders and experts on COVID vaccines, health equity, and mental health, and hearing from a top public health official about the state of the battle against the pandemic. We'll also be taking your questions from the comments for a special finale Q&A on Friday, March 5th. You can learn more about the full lineup at Johns Hopkins SPH on Facebook, and be sure to tune in live for the first session on Monday, March 1st at 11 a.m.
This week, the United States passed the tragic milestone of 500,000 lives lost to COVID-19. Today, I speak to Annette March Greer, an amazing nurse who founded and leads a grief counseling program in Baltimore called Roberta's House. Let's listen. Annette March Greer, you are a nurse and the founder and president of Roberta's House. And I'd like just to start by asking you to orient our listeners to what is Roberta's House?
Yes, hello. Roberta's House is a family grief support center that was established 2007 to meet an unmet need and to address the complicated and unresolved grief of children and families living in urban communities. And we provide grief support, counseling, and peer support programs to children and adults of all ages with various types of losses.
So could you give a few examples of the types of losses you have typically supported over the years?
Sure. Many of our families and individuals come to Roberta's House due to traumatic losses, such as homicide, overdose. And we also do, unfortunately, have a large population of individuals who die, I might say, premature deaths due to heart disease, kidney failure, and cancer, most frequently.
And so each of those deaths creates a circle of grief, essentially, in their family, and then they come to you.
Absolutely. We don't talk about death and grief, and oftentimes there are no resources to provide that type of support. And so the work that we do at Roberta's House is very specific to meet those needs and helping children and families to adapt and adjust in a healthy way to, this crisis in their life.
So what kind of services do you provide? Can you just give an example of how you may help a family in grief?
Sure. So once a family enrolls into Roberta's House, they're invited to come into one of our programs. And most of our programs are for 10 weeks. And they are provided a meal and a gathering space where all of these children and families come together. And we establish a theme for that night. and activities, a curriculum that each age group works through. Children are divided up into kiddos, middles, and teens, and adults go into their separate groups. And we have trained volunteers who actually facilitate the topic and the discussions around the loss. It might be around feelings of anger, guilt. It might be changes within the family, role changes. It could be on any assortment of topics around the loss.
What do you hope when people finish a 10-week program that they can say changed?
Most individuals say that the greatest benefit is being able to identify with others and they are not alone in this grief experience, and that they feel that there's a sense of hope. Their perception is changed about the outlook on life, and they feel the support of having others and being able to converse and problem solve with each other, which brings a great sense of hope back into their lives.
So you have been helping families who have suffered terrible losses, homicide, suicide, other traumatic deaths, premature deaths from heart disease. And then we have the pandemic, your work with even more deaths. And in many cases, I'm sure deaths of some of the leaders of some of the families that you have been involved with. Could you tell me a little bit about what that's been like?
Well, COVID has definitely complicated and made grief a lot more traumatic for many families, because first, in urban communities, there's a 30% higher mortality rate. And now on top of this comes COVID, which not only has brought about more deaths, but has also people have lost their routines, their jobs, their rituals of mourning their loved ones. They've lost the ability to connect with one another and give that social support. So it has really shattered a lot of hearts and minds during this time. COVID was definitely last year and this year. I would say that this year we're hopefully looking at a period of mending, and last year was a period of being shattered in so many ways.
Were there any differences in the kinds of grief or experiences of loss from COVID compared to some of these other, traumatic events?
The biggest difference was that people were not able to be with their loved ones in the hospitals or dying, or when they had a funeral service, or, only 10 people could come to the service. Many people had to choose cremation over traditional burials. And this really challenged people's belief systems and their sense of peace and calmness during this, their grief.
What would you do to try to help them?
Well, the greatest support is listening and being there as a supporter and understanding and helping them to process what they've created as far as meanings out of their losses and how they can find a positive outlook. Grief is a crisis. Death is a crisis. And what's really important and we help people to do is, yes, there's danger in a crisis, but there's also an opportunity for growth. And there's an opportunity to find insight and wisdom in even a crisis. And that's our goal, to help people change their perspective and to change their outlook so that they can build their resilience and build their support systems.
And have you been able to create virtually the kind of community that you had in person? I know you have a wonderful center, and it's really almost the architecture of the space that makes people feel comfortable. You've had that taken away from you, I'm sure, for parts of this pandemic. How do you create that sense that people aren't in it alone?
Yeah, so of course, when back in March, Roberta's House had to pivot very quickly and turn to virtual support groups and sessions. And of course, it was a challenge. It was a challenge for us as well as it was for getting people connected and understanding how to work, on Zoom. But believe it or not, it has been a growing experience for everyone. And we have successfully been able to still reach our clients and families and create these virtual groups where now people are in their homes having support sessions, and they're finding it still very helpful and needed.
That's great. I want to ask you to broaden the lens a little bit and think about the national trauma we've gone through. This week, we have passed 500,000 deaths from the pandemic in the United States alone. And, you know better than anyone, just, the circles of pain that causes. So there are 500,000 circles of pain like that. What do you think the nation can do to help heal the trauma?
Well, I think globally, the first thing is, that we all need to be more sensitive and understanding to the needs of individuals emotionally and spiritually. As I said before, this year, we really should look at this year being a year of mending the shattered hearts and spirits of so many people. So, I think that our government needs to recognize the need for more mental health services to meet the individual's needs emotionally and spiritually, to create these opportunities where people can memorialize and connect, and even provide more funding towards emotional well-being in our communities, and the need especially for our young people, because this has been a great crisis for our young people who, social development is such an important need for them, and they've been isolated in this last year, and they're struggling.
What can elected leaders or other community leaders do to acknowledge the trauma and suffering that people have from so many deaths? What would you advise the mayor or the governor of a city or state to say? I mean, should they just pretend, that we're just moving on with the vaccine? Should they pause to talk about the deaths? What would you recommend?
Absolutely. I think acknowledging the losses that people have encountered is so important. People need to know that we are paying attention, that if our leaders are paying attention to their emotional and mental needs. So acknowledging that in every opportunity, and also creating opportunities where people can voice their concerns, can voice their losses. And again, once again, to provide the support to those programs who are doing the work like we're doing in the communities, especially with our schools. Our schools desperately need the emotional support and the mental and emotional support in order to get these children grounded and feeling safe enough that they can continue to learn.
So many people who are listening to the podcast have lost loved ones, or I would say pretty much everyone listening to the podcast knows someone who's lost a loved one from COVID. Sometimes it's hard to know what to say to other people in your family or other people in your life. Maybe you don't know them that well, but you know that they've had a loss. What would you say to someone who wants to be helpful but isn't sure what to do?
Most of us have this desire that we want to fix people and we want to change how they're feeling. And sometimes that's just not possible. Believe it or not, we sometimes have to experience the pain in order to heal first. So the first thing that an individual can do is to acknowledge that it's okay not to be okay. It's okay to be angry. It's okay to cry. It's okay to express your pain and allow someone to do that without trying to fix them or to change. So, just allowing people that space to process their grief and their loss is so, so vital and important. And just being present.
Let me end with one question. I know of the tremendous work that Roberta's House does, and you're one of my heroes. I'm wondering if anyone listening does want to make a contribution to Roberta's House, what can they do?
Sure. Well, of course, they can visit our website, robertashouse.org, and visit and see some of the programs and the work that we're doing. And I'm also excited to say that we have just constructed a new bereavement center in Baltimore, and it is the first of its kind. It is a bereavement center that has been created for families living in urban communities. We serve primarily people of color, and there's an opportunity to memorialize your loved ones by having their name placed somewhere in this center. And there's also an opportunity to support one of the programs. So there are many different ways of giving to Roberta's House to continue, our work.
Annette March Greer, thank you so much for joining me today.
Oh, and thank you for the invitation, Dr. Sharfstein.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, C.N. Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo and Neiman Outland. Social media support from Brenda Haggader, Grace Holes Fernandez, and Caroline Wong. Thank you for listening.